Tadhg Daly is the CEO of Nursing Homes Ireland. Tadhg, thanks for joining me here on the show. I want to be fair to the staff at Aylesbury and Ashbury Nursing Homes, and as Alison said, look, there's no evidence that there was staff members who refused to take it, and then when they heard that there was a cash raffle on offer, that they changed their mind and decided to take it. But the mere fact that a raffle is being used to encourage uptake, I mean, I can tell you, looking at the text line here, that's really annoyed some people.
Yeah, I mean, it's news to me, to be honest with you, Kieran. What I'm hearing from right across the country since the commencement of the vaccination programme is the opposite. Is that the huge numbers of uptake right across the sector, both nursing homes and indeed acute hospitals. You'll be aware from your programmes and indeed other programmes where the biggest complaint to date has been the difficulties with supply and the scheduling. So people are very, very anxious to get the vaccine. Anecdotally, we're hearing figures of north of 90%. So I suppose it will take some time. What I'm also hearing is that a person may have declined the vaccine on the first dose, and then when the vaccination team come back to a particular nursing home, they're actually saying, well, now I wish to take it now on the second time. So
why would they refuse it the first time, Tadhg?
Yeah, good question. I mean, ultimately, it is not mandatory, unfortunately, and I would be at one with the CEO of the HSE, Paul Reid. I would think as well that both from their own perspective, from those that they care for, and from their family and friends, that everybody should get the vaccine. They should inform themselves, educate themselves, obviously, in terms of the components of the vaccine and the pluses of the vaccine. But until such time as the legislators act, and if they deem it appropriate to act, then I suppose all of us across the entire health service, whether it's acute hospitals or indeed community or nursing homes, will be, using all our endeavours to fully promote it and to work with people. But I think the next steps will be interesting, because once we get a picture, I suppose, of the uptake, then that will determine, I suppose, what happens next, as I say, right across the health service.
What's your own opinion, Tadhg, though, of why people might be refusing it? Because I know you mentioned about some reluctance and it's a new vaccine and all of that, but we have this strange situation every year in the health sector where there's a shockingly low uptake of the flu vaccine, for example. Now, it's improved in recent years, it's on the way up, but it's still an awful lot lower than ideally it should be. There seems to be this culture among some workers, not all, but among some, that, you know what, we're young, we're fit, we're healthy, we're not the people who end up in hospital, let's not take it.
Yeah, absolutely, and I think that's the challenge for us all in society, is to ensure that the vaccine hesitancy, or indeed the complete opposite extreme in terms of anti-vax, is challenged in that respect. You're right, the flu vaccine has struggled over the last number of years, but it has increased significantly, and there is a campaign right across the health service to promote the flu vaccine. We were, if I'm honest, I suppose, maybe not nervous, but watching this space very carefully, because we were conscious of what happened in the flu vaccine, but that is not being replicated, I can assure you, on the information I'm getting at the moment with COVID. The COVID vaccine is in high demand. Now, that means we cannot be in any way complacent. We have to ensure that we literally take any and all steps to continue to promote it. But you're right, the flu vaccine has struggled over the years, as I say, not just in nursing homes, but also in acute hospitals.
And I appreciate you said, look, you have reports back of up to 90% plus, the people taking the vaccine. Alison Woods from Aylesbury and Ashbury Nursing Homes, I think she had 36 out of 170 refused to take it, which is about 21%. I mean, in situations like that, Tadhg, should those people be allowed into work and work with vulnerable patients?
Well, at the moment, the advice that we've received, obviously, is that it's not mandatory. Clearly, what we'll have to do then is do a risk assessment. So in any case, in any work employment, whether it's COVID or indeed any other challenges, one has to do a risk assessment. So that will inform next steps ultimately. But I mean, I personally would feel that no, it's not appropriate. I think that as a society, we should have a zero tolerance in some respects towards the vaccination, particularly given what we've been through as a society and as a country over the last 12 months.
Would you support the government making it mandatory? I mean, you can't study for certain courses in the health industry in this country unless you've been vaccinated.
Well, I mean, nursing home sector is arguably, the most highly regulated in terms of Garda vetting, in terms of training requirements. So yes, absolutely. If appropriate, I think that if the legislators were to move and legislate for COVID vaccination, then that is something that we would absolutely support.